I'm David Morrity from Physio Health. I want to talk a little bit today about the effect of the femoral nerve. A lot of people have heard of the sciatic nerve, which is down the back of the leg and creates a lot of pain down the hamstring and calf. The femoral nerve I find is equally clinically as important. It's the nerve going down the front, still from the lumbar spine, but through the hip flexors and down the thighs. It can give you thigh pain, knee pain. It also can help create this type of posture that Adam here has, which is hyperlordosis, which means increased curvature, which can cause a lot of facet pain. And when you go backwards, Adam, where are you feeling that?
Pretty low.
Okay, so he's feeling some low back pain. You can sort of see that it's hinging there. But what I think is that he's got tight hip flexors, and that is locking his pelvis forward and causing load on his facet joints. And this is something we see all the time in chronic lower back tightness. Adam's been doing a bit of running, which would probably be accentuating the problem. So what I want to look at is his femoral nerve in prone, and then a couple of things to improve that, and then see if that results in a better quality of lumbar extension and more comfortable. So on the tummy, mate. So the femoral nerve has nerve roots from L2 to L4, so through this part of the back, and normally what I find is he's going to be really stiff in that associated part of the lumbar spine. How I sort of get a quick measurement of the femoral nerve is to put his hip in extension, to then block by putting some force through to get his pelvis level, and then measure by seeing how far his heel will get to his bottom. You feel a strong stretch there, Adam?
Yep.
Okay, I'm feeling tension there. Is that pretty intense?
Yeah.
Okay. So have a quick look at the other side. And I'm finding this technique really helps with chronic lower back pain. So anchor him down there. That one as tight as the other side? Okay. Doesn't feel quite as tight, but his foot's a bit closer there. So what I'm going to do, there's all sorts of techniques we can do with the lumbar spine. We can do some trigger pointing through his quadratus lumborum here. We can do mobilising of the facet joints, or a combined technique like this. So I'm coming quite laterally there. And I find actually releasing up a little bit higher, even the lower thoracic spine, because the hip flexor or psoas muscle comes from the anterior part or front part of the vertebrae right up to T12. That you can, releasing the thoracic spine will help as well. So we can do a thoracic manip while we're at it. Burger with the lot. Big breath and out. Beautiful. Come around this side again. I'll just do some moves. This is sort of a myofascial technique. I'm coming in lateral to quadratus lumborum. I think I'm getting a mobilising effect of the lumbar spine as well. He actually feels to me a bit tighter, even a bit higher than my target spot. So I tend to go on with these on fairly generally what I feel rather than targeting a certain level. So this is for someone who's presented just with generalised low back pain. Okay, let's have another look. Lift up there. Relax, mate. So I'm anchoring him down. So that's pretty good. Does that feel easy to you?
That's still a strong stretch there. That's better.
Yeah, but I'm getting it all the way down. Now if I release his psoas, just flip onto your back, mate. And just do a psoas trigger point. So lift your knee up and down. Try and smile for the camera.
I'm better if I'm going to cry.
Don't try this at home. Just do 3 or 4. I mean, you can do a lot more of these techniques in a real treatment setting. That's it. I used to like to come from the opposite side to get onto the side. Up and down there, mate. So we're doing a trigger point release of his iliopsoas muscle. Pretty tender. Okay, and then back on the tummy again. Relax there. It's actually easier now to push his hip down that I've actually released his psoas. Strong stretch there.
Yeah.
We're getting a lot better range. Okay. Now stand up and try that lumbar extension again, Adam. It's a bit more even contribution. Are you feeling any resistance there?
A little bit down the very bottom, but not much.
Not much, okay. and bigger range. The other stretch I might do, this one I sometimes teach this as a home stretch for clients, is just right on the edge there, mate. We did the femoral nerve stretch. So this is one that, another alternative to stretch that same region. So lying down, what I'll do is I'll come in here, bring his knees up, I'll block this hip inflection and then drop that one down, a bit hard with the Sunday best on, and then just, I'm stretching hip flexor there. If I want to wind up the knee flexion, then we're getting more of a femoral nerve stretch. And that's another one we can do at home.